Years ago, in Chile, the country that I was born, they were selling a product called caffeine aspirin, meaning that it contained both caffeine and aspirin. It was used for pain and relief of joint pains and a number of things. I haven't seen it here in the States. I have been living here for 30 years, never heard of it. But in Chile it was very popular. People loved it, and with good reasons, because when you combine caffeine with aspirin, the result is excellent. They both potentiate each other. However, aspirin has many dangerous side effects. Aspirin can really kill. Dying because of an overdose of caffeine, you have to do something very, very stupid. When you look at the many benefits that caffeine can produce, you come to this simple conclusion: the real wondrous drug is not aspirin, it's caffeine. Now, it looks like nature has made sure to put caffeine everywhere in the world in different forms. It's like you can't miss it. If you are born in Brazil, you will have access to mate, which has MATEIN, a very similar active ingredient to caffeine. Guarana, another one that has a form of caffeine. If you're born in Argentina, you have mate. If you're born in China, you have tea, and black tea has TEINE. Green tea also has caffeine. It just has less caffeine than black tea, but it has caffeine too. So caffeine is always available. Caffeine has a very interesting effect in the brain. It stimulates the whole brain in a way. It's like the brain lights up completely with a little bit of caffeine. Now, how powerful is caffeine to increase concentration? Is roughly equivalent to 100 milligrams of caffeine is roughly equivalent to 5 milligrams of Ritalin. That's the equivalence. So I remember when I was working in psychotherapy with families and children that had concentration issues or ADD or ADHD, a therapeutic dosage could be, that was given by a psychiatrist, 10 milligrams of Ritalin, no more. It will have an effect. It was also normal that he would give to a child 20 milligrams of Ritalin. Now, 20 milligrams of Ritalin would be only 400 milligrams of caffeine. And that's not something difficult to ingest. How do you do that? One shot espresso in a Starbucks cafe or coffee beans will provide you with about 100 milligrams of caffeine. 2 shots will provide you with 200 milligrams. So 2 shots in the morning are equivalent to a 10 milligram tablet of Ritalin. And I can tell you that it's as effective. But it doesn't seem to have all the side effects that Ritalin has. If you go to our website at brainoptimization.com and you search there in the articles that are in a table of contents, you will find information about how Ritalin produces chromosomal damage in just 3 months when it's given to children. And to adults, of course. So caffeine doesn't produce chromosomal damage, of course. And you have there, in caffeine, just simple coffee, the possibility of using a natural substance to increase your concentration without all the problems of methamphetamines, like Ritalin or Adderall or others. Now, I'm sure that some people that will watch this video have children that are experiencing ADD symptoms. I would like to tell you this, is They are not experiencing ADD symptoms because they have a lack of caffeine in their diet. That's not the case. The brain should work without the caffeine and provide enough concentration. They probably have other nutritional deficiencies that need to be addressed. They don't have also a Ritalin deficiency, so that's not a good idea to give them Ritalin. And on the other hand, if they need medication or they need something, I'm not suggesting you to give caffeine to the child to solve the problem. My recommendation is to do a thorough and responsible nutritional approach to ADD, and if it's necessary to add a little bit of caffeine in order to balance the brain and create the right effect, you can also do that. But it hopefully will be the minimum necessary, or maybe nothing. Also, when it comes to giving caffeine to a child, regardless, under all circumstances, I fully understand the challenge for a parent to make this decision and go ahead and do it. However, if you notice what other cultures are doing, that don't use Ritalin for children, many cultures, they give caffeine to their children. Like in Argentina, it's not uncommon that children will drink mate early in life. Or in Armenia, they will drink coffee. Or in Italy, they may drink coffee too. So I was born in an Italian family, and I was very young when I began drinking coffee. I have concluded that I was taking about 400 milligrams of caffeine per day in 2 dosages. This was a coffee milk that we used to prepare at home with instant coffee. Instant coffee, by the way, is loaded with caffeine. So I was taking roughly about 400 milligrams, if not more, per day. That's equivalent, in fact, to 20 milligrams of Ritalin, which is a therapeutic dosage. I would say that probably was less damaging to get all that caffeine that having Ritalin in my diet, which is not a food, right? And my concentration is good these days. In fact, I can take the TOBA test, which is the gold standard to diagnose ADD, and pass it with concentration above normal. With, as I said, a combination of supplements, good diet, and these 2 cups of coffee during the day. 2 shots in the morning and about 1 shot after lunch. So it is a sensitive decision for a parent to give coffee or caffeine to a child. And I fully understand that you may want to consult with a practitioner or a doctor that understands the subject and is not bent on giving pharmaceuticals to the child. Also, an alternative that they may suggest is that you give them caffeine tablets, which is something that I don't recommend, because the substances that accompany caffeine in coffee and mate and tea are valuable. In fact, most of the antioxidants that are ingested by the American population today are due to coffee. You ingest them in coffee. So we are deficient as Americans. We are deficient in antioxidants in our diet. We only take about 2,800 ORAC units, and the recommended amount by the USDA is 3,500. However, most of the ORAC units that are consumed by the average American come from coffee. Now, if you consume coffee regularly in Starbucks cafe or in coffee beans, it becomes a significant amount of money at the end of the month. Let's say you take 2 shots of an espresso in the morning and later after lunch, you're spending about $4 per day or about $5 per day in coffee. And multiplied by 30, we are talking about $150 per month. You can produce your own coffee at home for much lower amount of money than that. And so how you prepare it? You can buy, those coffee makers machine, but I don't recommend them for different reasons. First of all, they have different metallic parts and rubber parts that may leach chemicals into your coffee. And hopefully, if you produce it at home, you will use organic coffee, because coffee is a harvest that is not clean. It's the farmers use a lot of pesticides in coffee unless you consume organic coffee. So that's another advantage of consuming coffee at home and producing it at home. So how you do it is very simple. Just grab, for example, about 1 rounded teaspoon and put it in a pan. Add some water, small cup, like the Italian cups for coffee. Add it there, boil it, and once it's boiling, turn it off and pass it through a strainer. And you have a coffee right there, and it can be delicious. You can add a little bit of honey instead of sugar, which is much better than sugar for your body. You can also use agave, which is better than sugar too. But honey is the best. And then you will see that it will taste delicious, and you will save a significant amount of money, and it takes very little time to prepare. Let's talk about coffee and anti-aging now. Coffee seems to have a very interesting anti-aging effect. As I mentioned before, it's full of antioxidants, and if you are careful to consume organic coffee, you will get a large amount of antioxidants without the pesticides of regular coffee. Additionally, there is research indicating that one of the factors, the main factor perhaps, where there is practically agreement in the anti-aging community, one of the main ways that we age is because of insulin resistance. This means that your cells are becoming resistant to insulin, and then your pancreas needs to produce higher amounts of insulin in order to produce the same desired effects, which is to bring glucose into the cell. Insulin acts like a signal to the membrane of the cell to open the doors and allow glucose to come in. But if the membrane of the cell becomes resistant to the signal, then your pancreas needs to produce more insulin. And insulin has pro-inflammatory effects, and therefore we age due to insulin resistance. And when the insulin resistance is significant, it begins to deteriorate the body. If you are interested in taking a course on brain optimization with emphasis in nutrition, look for the link that is right below this video in our YouTube channel. And we offer a couple of classes that are completely free of charge, video classes, and they have valuable information, including an extensive class on the subject of glucose. And then if you're more serious about it, if you're really interested in the subject and you really consider your brain something important, that hopefully you do, then you may consider signing up for our certification course in brain optimization, which is, it contains very valuable information to optimize your brain and to be happy. Because if your brain is happy, we tend to be happy. If your brain is unhappy, it will be very difficult. Take care, and don't forget to check that link. Bye.